Hey, thank you. Good morning, everyone. Welcome to part two of our webinar today. Part two is on Wednesday. My name is Morgan Peters. I'm the Policy and Research Manager at the Fredericton Chamber of Commerce. I'd also want to introduce Sherry Somerville, who's the Chief Executive Officer of the Atlantic Chamber of Commerce. And thank you to the ACC for co-presenting these two sessions with us this morning. On Wednesday, we had 53 people participate, which focused on risk, and the feedback we got was really fantastic. And I can see why I participated in the first one too, and it was really great, really interesting. I could have listened all day actually. When we do get rolling this morning, David is going to do a quick recap of part one for folks who are not able to attend on Wednesday, and for those of us who can always use a refresher. As Tanya said, today's session is being recorded, so we can check it out later and share with people who weren't able to attend. Please make sure your microphones are off unless you are speaking. We do encourage you to leave your camera on if you're comfortable with that. It's nice for the presenters to see some faces out there. And with the number of people here, we encourage you to ask questions in the chat function at the bottom of your screen, and I'll ask those after the presentations. And if we run out, then we'll take more questions from the floor, as it were. Before I introduce today's speakers, I want to let you know that they are all donating their time and expertise to offer these sessions to us. And all they're asking is that if you or your organization is able, that you join them in donating to your local food bank, which I think we can appreciate. They're going to see a heavier load here currently and moving forward as the economic fallout of COVID is felt for some time. So thanks to our speakers, that's a win for us and a win for food banks across the province. So presenting today, we have Dr. Matthew Burnstein, who is an occupational health consultant and family physician, formerly based in Halifax, now in Toronto. He's had a 30-plus year career, was formerly the Chief Medical Officer for Bell Alliant and Divisional Occupational Health Medical Consultant for Canada Post in the Atlantic Division. He has extensive experience in pandemic planning, formerly with SARS, H1N1, and now COVID. Since early March, a significant portion of Dr. Bernstein's practice has been providing advice to clients through Canada as to the risk COVID-19 poses in the workplace and strategies to mitigate that risk. David Clark has practiced law for 38 years and is based in Fredericton with a national practice primarily focused on labor, employment, and occupational health and safety law. David primarily works with proponents of major construction projects in the hydro and mining sectors located in northern Canada. Since early March, David has worked exclusively with multidisciplinary COVID risk management teams in developing workplace policies, standards, and procedures to mitigate the risk of employees contracting or transmitting COVID. Glen O'Neill is a Canadian registered safety professional based in St. John's. Glen has 25 years of experience both in the public sector, working for Government of Canada, and in the private sector in oil, gas, and renewable energy. Glen is currently the Health, Safety, Security, and Emergency Response Manager on a component of a large hydro project. Since late February, Glen has worked exclusively in the area of pandemic risk management as a member of a multidisciplinary team. Glen has developed and implemented workplace policies, standards, and procedures to manage COVID-19. Finally, Brad Proctor has practiced law for 18 years, is based in Halifax, and is a partner at McGinnis Cooper there. Brad's primary focus is labor, employment, and occupational health and safety law, servicing clients throughout Atlantic Canada. Since the beginning of the pandemic, Brad has worked almost exclusively in providing advice to clients regarding how to minimize occupational health and safety risks associated with COVID. Today's presentation is going to focus on operational plans, which we all now need in order to operate under the province's emergency declaration. Our chamber has posted hours on our website if you want to check that out as an example if you're still developing yours. And so with that, I will hand it over to David to get us started this morning.
Good morning, everyone, and thank you for taking time out of your day to participate. And just a very quick recap, because many of you were on the call on Wednesday, is that this team works very closely together in supporting myself, Glen, and Brad and Matthew in supporting a project in Labrador to keep it operational throughout the COVID period. And I also work with as support a team that does the same thing in Nunavut in the high Arctic and in northern Manitoba. And one Saturday morning we were talking about how much time we were putting into this and how many things were happening in real time that were changing as we were, helping the business react so that they could keep operating. And I said one morning, how the heck will small business be able to handle this? Because so many things are changing in real time. And there's no group of businesses that have been harder hit than small business in Canada and in Atlantic Canada as a result of COVID. And small business, as I said, I believe I said Wednesday, is the engine that drives our economy. It's one of the most important sectors. So we really hope that you'll find this presentation helpful. If Tanya, if you could just go ahead and I'll just give a brief overview of what we're. Glen O'Neill is going to provide us with. We always start our meetings with a safety share. Glen, due to technical difficulties, was not able to be with us. You will not see him because his audio function isn't working, and his visual function on his computer is not working, and his IT from his company, given COVID, weren't going to do a host call, but we have his voice. So Glen, if you could do a safety moment.
Thank you, David. And to add, my wife tells me I have a face for radio, so that works as well. So with our primary focus being COVID-19 and the health and safety measures, I guess, that we're looking at to safeguard against this pandemic, my safety share is really to think about your existing health and safety policies and procedures and anchor back to these policies and procedures as we return to the new normal workplace, if you will. Think about how COVID-19 health and safety measures can be incorporated into your existing plans and ensure that we have a safe and healthy restart for all.
Excellent. Thank you, Glen. And what we're going to cover today in the session is a quick review of your legal obligations. And secondly, Matthew covered in detail the medical risks. We're going to do a brief recap because all of your risk management measures are based around mitigating against these medical risks. And then we're going to get right into the nitty gritty of running your business, of managing, working inside 2 meters, PPE in the context of small business, hygiene and disinfecting in the context of small business, the types of work rules. We provide you with some examples that you should consider putting in place to so that your employees are aware of the importance of the things they need to do in COVID. And these are actually, in our view, incredibly important safety rules. Now, washing your hands and hygiene you don't see that except in food processing plants and hospitals as a work rule. Now that's a very important work rule. And then Brad's going to do the heavy lifting towards the end because there's now been, we've been operating for close to 3 months in the COVID world, 2.5 months. And there are some very common legal questions that your employees are going to, common sense, but legal questions you're going to hear from your employees. So if we could just snap ahead to the next slide. So as I said on Wednesday, you have an overarching obligation under the Occupational Health and Safety Act to take reasonable precautions to ensure employees are safe. And this obligation certainly extends to the COVID risk world. In addition, and the next slide, Tanya, on May 8th, an order was passed, and this is a New Brunswick order, but the principles for those that watching in Nova Scotia are similar. By law, small business and all business, and it's a personal responsibilities and owners and managers to ensure minimal interaction of people within 2 meters, prevent persons from entering your workplace that have symptoms, and to keep travelers from outside the province from entering your workplace. There are a list of exceptions we'll be talking about later. And moving on, so that the province of New Brunswick, because myself and our team and Brad monitor what's happening in every jurisdiction in Canada, and the New Brunswick guidelines are amongst the best in Canada. They're modeled very much after OSHA guidelines that came out early in the United States. Quite frankly, well ahead of the CDC guidelines in the United States, which will be the holy grail that just came out. Were delayed because of our because of the politics to the south, which I'm not going to comment on. But so you must have a an operational plan, and you must comply with the guidelines for reopening that Workplace NB have put on their website, which are excellent in the resource materials at the end. There's a web link. And you need to have that done before you open up. And you don't have to provide it to anyone in advance, but it has to be available on demand if a WorkSafe inspector comes to your business. Next slide, Tanya. So, as I said earlier, it's incredibly important that when that you understand how COVID can be contracted and transmitted, in putting in place measures in your own business, because every business is different to manage this. So I'm going to hand it over, and Matthew is going to do just a quick recap. And the other thing I want to say is that we should be able to get through the bulk of the presentation, because I know that the province is doing here in New Brunswick a in-use conference at 10:30 this morning about going to the next level of as we move from orange to yellow. So over to you, Matthew.
Okay, so for those who weren't on the call yesterday, and for those who were in advance of the exam at the end of today, I'm going to do a quick recap of the virology and epidemiology of COVID, and we may go on to the next slide. So COVID-19, so that stands for coronavirus disease, first diagnosed in 2019, and it's caused by a virus called the coronavirus number 2. First recognized among a group of workers in the Wuhan province in China who worked around the same fish market in the December period of 2019. The virus itself was isolated in January of 2020, so less than 6 months ago. And rapidly the virus has spread around the world. In March, the World Health Organization called it a pandemic, and it's continued to spread widely. In some countries, they're bringing it under control. In Europe, Russia, and Brazil. Brazil is just tracking very rapidly with many, many increased cases and high death rates. Move on to the next slide. So who can spread COVID? Well, obviously people with symptoms, but more worrisome is that people with no symptoms or in the early stages of disease who have no symptoms can spread it. And it's spread by droplets, by tiny droplets, where coughing, breathing, laughing. So if you're trying to laugh off COVID, you're spreading it, or if you're screaming at your spouse, you're spreading it. But simply talking is enough to spread the virus. And the virus is brought into the body through the nose, through the mouth, through the eyes, okay, either by someone coughing on you or breathing, or you're walking through a cough or a sneeze or someone breathing on you. Or the other common way to get it is you touch a surface and then touch your mouth, touch your nose, touch your eyes, which is why washing one's hands is so important, because that's a very common route of transmission. Okay, next slide. So touching surfaces, maybe go back a slide, sorry. It lives on surfaces for different lengths of time. Now, whether the virus that lives on a surface is still able to cause infection 24 hours later, 48 hours later is unclear. But as a precautionary principle, one should certainly avoid touching those surfaces. But more importantly, you can touch all the virus you want. It doesn't get into your body through your hands. It gets in through your mouth, through your eyes, through your nose. So again, hand washing is critical. So So it's important to clean surfaces, so if you inadvertently touch them and then touch your face, there won't be virus on your hands. But again, washing hands, keeping one's hands away from their face is really the key in avoiding transmission. Next.
And maybe, Glenn, if you could comment on the hierarchy of safety risk controls in the context of keeping it in the context of small business.
Yeah, so the graphic that you see in front of you is what's referred as the hierarchy of controls. This is a mechanism that we use in the health and safety sector to control hazards in the workplace. And if you start at the top and work towards the bottom, you start at the most effective to least effective. So what you need to be thinking about from a hazard control perspective is implement engineering controls first where they're reasonable and practicable. If they're not reasonable and practicable, move into administrative controls. And administrative controls are really methods that we use to change the way people work or even think about the way that people work and making changes to your organization to increase that 6 foot or 2 meter distance, which is so important. And the last, and I guess the last line of defense that you would implement would be personal protective equipment, or PPE. You want to use that as your last line of defense because once you remove that, you're directly exposed to the hazard. So think about this structure here, this framework. Think engineering first, administrative control second, and PPE third. You see here that New Brunswick WorkSafe NB has physical distancing here at the top of this framework. That's a good idea because physical distancing is so important in protecting against exposure to this particular pandemic. So that's a good model there for small business for sure.
Thank you, Glenn. And if we could just go on to the next slide. And so under the operational plan that you're required to have upon starting, the first workshop, we talked about screening people coming into your premises, both employees and customers. Today, we're going to focus on the third piece of what you need to have in the operational plan is to take reasonable steps to ensure minimal interaction of people within 2 meters of each other. If we could just go on there, Tanya. And maybe, Matthew, you could comment on this slide. You're muted, Matthew.
So this is really about the importance of isolating people and stopping the spread, and how easy it is for one person to, in a very short period of time, spread it to a large number of people. I didn't talk about, and I talked about it yesterday, but the incubation period. So from the time that someone gets the disease till they spread it to someone else, the average is 5 days. But the range is anywhere between 3 and 14 days. So the maximum incubation period from the time of contact till the person becomes ill is 14 days. So if 14 days have passed and you haven't contracted the disease, you're unlikely. In fact, there's no data to suggest you would contract it at that point. So if you've got one person in 5 days, they could spread it to 2.5 people. That's currently how COVID is acting. And if those 2.5 people each in 5 days spread it to 2.5 or 2.5 other people, and every 5 days you continue, in 30 days you'll have over 400 people infected. And that's sometimes referred to as the reproductive rate, or the R naught number, the R little zero number you see talked about of 2.5. And we want to get that number down to below 1. Because once you get it below 1, you can actually stop the spread of disease. It'll still be there, but it'll eventually die out because it won't have an opportunity to spread amongst enough people. Because it doesn't survive outside of a host. You need a person in which to have the disease. So every step that we've taken, and New Brunswick has done a fantastic job of doing this, as most of the Atlantic Canadian provinces have, and the prairies, of getting the numbers way down and reducing this reproductive rate. Okay, next slide. And physical distancing is really the most important way of reducing the spread. It's spread by droplets primarily. There's some talk about it being spread by aerosolization, But most people believe that 6 feet will remove the majority of the risk of transmitting the disease. And if we could all stay 6 feet away from each other and all never touch our hands to our face for 2 weeks without washing our hands, that over a 14-day one incubation period, this disease would virtually disappear. Next slide.
And just to comment and build on what Matthew said, and reflecting back to our last session, remember, COVID is highly contagious. And the reason that physical distancing is so important, the 2 meters, is there is no cure, there is no vaccine, and there are some hopeful drugs in the pipeline, hopeful vaccines, but this time it is our only surefire defense. So taking us to the next slide, no, excuse me, the previous one, sorry, Tanya. Achieving physical distancing in the workplace, you either do it by restructuring your workplace, your physical settings, the responsibilities of people, or engineering controls or administrative controls to reduce contact between people. And maybe if we, next slide now. So Glen, maybe you've been involved in creating a lot of these. So maybe you could take these next few slides that deal with techniques to achieve physical distancing in the context of the workplace.
Yeah, thank you, David. As David and Dr. Burnstein talked there, physical distancing is the most highly effective, one of the most highly effective means to reduce the likelihood of exposure. So we really got to work on that. So when you look at the workplace from a visual cue perspective, first thing you need to do is take your floor plan, analyze your floor plan to see how you can put in the directional markers to promote a one-way traffic around your workplace to eliminate two-way traffic and two-way interface, thereby eliminating or reducing or improving that distance, if you will. And then once you have your floor plan completed, look to get signs, stickers, things like that. So what we've done in some workplaces, we've actually put directional arrows, stuck them right to the floor, and provided the path of travel. Put signs around the workplace for people to turn right, turn left, go straight. Make sure that the exits are clearly identified. And I also put other signs around the workplace, warnings about maintaining 6-foot separation and things like that. You can also, as well, put, for example, we've used a safety vest in the workplace. Put a little sign on the vest to say, stop, you're within 6 feet. So it gives a visual reference to the person, probably thinking about something else, encroaching on workers. They think then about stopping and maintain that 6-foot distance. So there's lots of things you can do from a sign or visual cue as a reminder to maintain that physical distance. Next slide. So when we talk about administrative controls, and you saw it from the hierarchical controls earlier, there's a lot of things that we can do to promote safety and protection against COVID in the workplace. Some of the things you can do, for example, are stagger work hours and breaks. If you can reduce the number of people in the break room, do that. So stagger your breaks. You may want to reduce the number of personnel in your workplace if that works for you. Look at working from home alternatives. We're presently engaged in working at home initiatives, and it's working well. And of course, the virtual meetings. Prior to the pandemic, everybody was piling in the meeting room. Now they're doing teleconference calls, so that works well as well. And the other thing, of course, is arrange your workstations. Move them out, spread them out if you can, to reduce or promote this 2-meter, 6-foot rule. Next slide, I think. I think Dr. Bernstein would probably be able to provide better clarity on this one.
Absolutely, Glenn. And Matthew, if you could chime in on working inside 2 meters and how the risk becomes enhanced, and your thoughts on that.
Some of the studies have suggested that it takes about 15 minutes of face-to-face contact, sort of working shoulder to shoulder to somebody, working across a counter like these chefs are. 15 minutes of time is sufficient to spread the disease. Less time, you'll probably get away with it, but but even so, 15 minutes is the thought. Alternately, just sitting in a room 6 feet within that 6 feet window from someone, two people sitting in a doctor's office or a waiting room in a small space for 2 hours, that's also thought to be a sufficient amount of time for people to contract the disease. Okay. In 99% of cases, there'll always be outliers. I did see an interesting device advertised yesterday that you could give employees that they wear on their wrists, and when they come within 6 meters of each other, it starts to beep or buzz to warn you to move away, sort of like the beepers I've got on my car to warn me when I'm about to hit a pole.
Now,
So
over to you, Glenn.
thank you, David. So this slide here, I'm focused. I'm a health and safety guy, so I'm focused on the background, what's happening in the picture here on the slide. And you can see a lot of people heavily congested, and that was the way we worked before the pandemic. So what we got to think about when we're looking at engineering controls, administrative controls, what can we do here to reduce the number of people that are to the right table? And just look to your left. We have a somewhat empty table in the middle, and further left, we have even an emptier table. Can we rearrange this workplace so that we have good spread here of more than 2 meters? Can we erect barricades and barriers between the people? Can we install plexiglass and things like that to create a separation? And then lastly, if we can't do that or if it's not reasonable, then we go with our masks inside of 6 feet. So those are just some ideas for working in close contact. Next slide, please. So when again, just to re-emphasize the engineering controls, think about these measures that you can install in your workplace, like plexiglass or plastic curtains, or maybe you can even put in transparent screens or portable room dividers, workplace partitions, things like that, that will actually stop the transmission of the disease. The other things you can do from an engineering control, of course, is if you have large ceiling fans, you can push the air down to ground level and also improve the ventilation in your HVAC systems. There's filters now that are high efficiency particulate aerosol filters or HEPA filters that are good for improving the ventilation and minimizing the transmission of the COVID virus. Slide 22, please. And of course, just to build on administrative controls again, the rearrangement of the workplace to ensure six foot separation is an easy fix. We've seen it now in the last couple of weeks working with various employers. All you have to do is move apart your workstation to create that 6 foot spread. Big thing that we have to do as well from an administrative perspective is promote effective hand washing and establishing, erecting hand sanitized stations. We got to promote the hand washing and hand hygiene. And of course, you also got to educate employees about the 6 foot rule and also ensure that that's been carried out through a follow-up audit, if you will, or an evaluation upon restart. So there's a lot of things we can do from an administrative control before we get into considering PPE. David.
Okay, and just the suite, and Glenn talked about, after you've talked about working, trying to keep people first and foremost 2 meters apart, then if they work 2 meters apart, inside 2 meters, what we can do from an administrative and engineering point of view, and then the final line of defense against COVID, if you're required to work inside 2 meters, which means you're being directly, if there's somebody that has COVID, you're being directly exposed to the possibility of transmission and contracting. We have to look at face masks. We have to look at N95 masks and respirators, which generally aren't common in small business. They're very common in the construction setting or when working in confined space with dust. We have to look at face shields and goggles, have to consider gloves and protective clothing. Next slide, please. And maybe Matthew, if you could talk about a mask. Myself, for example, myself and Matthew are on a regular call 3 days a week with Glen, and we talked about masks this morning, and maybe if you could share, take us through these bullets and what you shared with us about surgical masks.
Okay. Well, I don't know that there's anything that's been as controversial as the appropriateness and where to use masks with COVID. And the guidance has changed significantly over the last several weeks, and from being nobody needs to wear them to everybody should wear them to, in some places, it's the law that you must wear them. So let's be clear, a face mask is simply a cloth covering across the face. A surgical mask is one that's approved by Health Canada. It has layers of cotton and it's very effective, but it's open on the sides, and both types of masks only prevent you from spreading it to other people, though it does stop some large droplets, someone spitting on you, from getting it there, but it really won't stop anything else because it's open on the sides. N95 respirators, and they're called respirators because they fit tightly around, and you should be fit tested with a respirator. So it's a very specific device. It's NIOSH approved. N95, it means that it's 95% effective in stopping the inhalation, so it protects you of particles greater than 0.3 microns. Okay, so they're very different devices. They do very different things. And currently the recommendations are that people, when they're walking around, if they're out in public places like grocery stores, pharmacies, where they won't be able to maintain 6 feet from each different distance, public transit, that they should wear a mask. And the government is suggesting that we not use surgical masks, that we use something that you buy or make at home, simply primarily to protect the supply of surgical masks. And things that you make at home, they're of some value in stopping the spread. If you use and you want something that's tightly knit, cotton, and has a high thread count, and you need 2 layers of it for it to be particularly effective. So where does one use a mask? Well, the N95 should be used, the current guidance is N95s should be used primarily in medical settings where you'll be doing a procedure which will result in aerosolization, so you need the protection. Surgical masks are recommended, and it depends on who you read and what province you're in. Surgical masks are recommended when you're going to be up close and personal with someone. In Alberta, for instance, and someone asked me about this yesterday, hairstylists in Alberta, they're suggesting that hairstylists wear surgical masks. Okay. In other provinces, they've said masks. Okay. So it's nobody knows for sure. My thinking is that given the precautionary principle, when you are telling employees, people who have no choice but to do what you tell them to do, to work within the 6 feet distance, you should provide them with the highest level of protection that is available. I don't know that N95s are always available. Surgical masks, if they are available, would be my recommendation if you can get them. But that's certainly not the law in the province, and it's open to negotiation and debate. Okay. And I would say that one of the most important keys with masks is putting them on and taking them off properly. Wash your hands before you put them on. Wash your hands when you take them off. And there are proper techniques for disinfecting them. And if they get wet because you sneeze inside them or because the moisture in your breath, they stop working, so you have to replace them.
Thank you, Matthew. I expect at the end we'll have some questions around masks, because inside 6 feet, that's where they are. And the next slide is there for information purposes. This is actually on the Government of New Brunswick website. When you go to the link that deals with guidance, the guidance one we spoke of earlier, and at the bottom there's a checklist, and there's a web link to it. So it gives some great information on how to put a mask, how to put on your mask, how to remove your mask, and how it should be worn. Next slide. Okay, Matthew, maybe if you could, the other PPs that are commonly talked about are gloves and face shields. Maybe if you could talk about what, if any, use gloves would be in a small business context. And we're talking here about the plastic gloves.
I'm not sure where gloves really fit in, because gloves, you don't contract the infection through your skin. Okay, they look good, but it doesn't really protect anyone. The key is washing your hands. So if you touch something with a glove on and then touch something else, you're still spreading it. If you touch, and maybe gloves might disinhibit someone from touching their face, but I don't really think so. So I'm not sure where gloves really play a role outside of perhaps a hospital setting where you're dealing with mucus or wet material, but otherwise I don't think there's much role for gloves. What gloves, type of gloves should be used? Non-latex gloves to avoid latex allergies, and one that are is approved for Health Canada. That would be probably my guidance. Face shields are really interesting. And there's a move afoot to encourage the use of face shields, particularly ones that go back behind the ears and come down below the chin, because that provides a level of protection very much like a mask does, both in terms of it coming towards you, okay, and in terms of you breathing it out. The shield can collect some of that. And where should you use a face shield? I would say when you're going to be up close and personal with someone, certainly when I'm examining someone, particularly the head and neck. I don't know if I need a face shield when I'm looking at somebody's toes or their abdomen, but certainly when I'm doing an ear, nose, and throat exam, I do. I think a face shield would be reasonable for someone, again, we'll go back to hairstylist, who's going to be, again, up close and personal with someone, and going to the Alberta guidelines on hairstylists, they do suggest face shields as an option. So I would say if you're up close and personal, where there's going to be breathing on you directly for an extended period of time, a face shield is a good thing. Because again, the eyes are another area in which you can contract the virus. Okay.
With the face shield, is a mask also recommended, or what's your view on that, Matthew?
I would say both. We'll know more in 6 months. But right now, people who are propagating the face shield are also saying you need a mask as well. But you may see some discussion in the literature on people just wearing shields alone, but I don't think we're there yet.
Okay. On this next slide here, you spoke, Matthew, earlier about how long COVID survives on surfaces, which is critically important for a business owner to know in order to talk, the frequency of disinfecting, how to disinfect. So copper is a common surface, 4 hours, up to 24 hours on paper, which in an office setting is very important to know. And then 2 to 3 days on plastic and stainless steel. But what about other surfaces like clothing or uniforms or the other types of surfaces that you would have in a small business context?
Absolutely. The material, the COVID can survive on clothing, different material for different lengths of time. And I actually don't have that data. But again, the key would be you'd have to touch that piece of clothing and then touch your face. But it's a good idea for everyone who, once they come home from work or shopping or doing whatever, to change their clothes, because anything they may have picked up, they may inadvertently touch their clothes and touch their face. And people are doing activities which would get them closer to people or exposed to, again, I'd go to people like massage therapists, hairstylists, other people who are close to people. Probably not a bad idea to think about wearing a gown, a disposable gown, or an apron that gets left at work. So it's one less thing to transmit the infection, one less surface for you to carry home with you.
And would you recommend that people then that work in a workplace where they're going to be inside 6 meters, 6 feet or 2 meters, that they would wash their clothing take it off after work and wash it?
Oh, ideally, and in fact, maybe even come to work with your street clothes, put on something that you're going to wear at work, and then change before you go home. But certainly washing it. But again, the key is if we were all really religious hand washers, we really wouldn't worry about this because again, you need to touch the material, then touch your face.
So it's being the religious hand washer. Okay, if we go on to the next slide. And so,
Sure.
Matthew,
I would say double it up, whatever you normally do, twice a day. Certainly at the start of the day, the middle of the day, at the end of the day, all the surfaces should be cleaned. But depending upon what the surface is and how many people touch it, some surfaces need to be wiped down every hour. I mean, if it's a counter at a where clients come and are putting things on the counter, there should be a wipe there and basically wipe it sort of between every customer, depending upon what it is. Certainly restaurants, food surfaces, that would be critical.
well, what should people use? I know we have every community. I know the Fredericton Chamber have a number of members that are in the business of cleaning and disinfecting and selling those products. But what products should small business look for in order to effectively disinfect and clean for COVID?
Yeah. Health Canada, and I think we have a link on our presentation, has a list of products. And there's stuff you can make at home with Javix and diluting it. I don't recall the exact formula. And keep it on hand. Make it easy, and that's one of the engineering controls. Make it easy to do the right thing. Have the bottle of wipes right there on the counter, so it's easy to do. And then wash your hands afterwards again.
In the materials, then we have resource materials that are referenced, and everyone has the presentation on, right. And I think most of them are readily available when you have a chance to review those list of products. Right. Next slide. And again,
there's the formula for making a disinfectant.
There is a formula right there that we had in the next slide, so that you have it in your presentation. And we also have the web link to it. And next slide, please. Now, Glen, where you work on a big construction site, a lot of equipment, a big accommodation complex with much like a restaurant, serving people 3 times a day. So in the context of now small business, maybe you could talk about, take this slide.
Yeah, thank you, David. This is an interesting slide indeed. So in a lot of cases, we do share tools, we do share equipment. If we can eliminate that, if it works for you and you can avoid this, then my recommendation is that you avoid it. If you can't, however, it's critical that you implement a robust cleaning and disinfecting protocol using the products that's referenced earlier through the Health Canada website there, prior to the use of the equipment and after use. Clean and disinfect the common surfaces regularly, and you may want to develop a cleaning schedule to do this, of course, and ensure that that's being carried out. If you're looking at, say, restaurants, for example, you'll want to use disinfectant wipes before people use your chairs and tables, so prior to the use and then after the use. You see in a lot of locations today that they have barriers in place around cash checkout machines, but the touchpad is a multi-use item. So what they do prior to handing it to you, they clean it, and after you pass it back, they clean it as well. So you'll have to get into that routine of cleaning and disinfecting, and always after that, make sure the proper hand hygiene, as Dr. Burnstein referenced.
Next slide. And take this too, Glen.
Okay, yeah, so similar for lunchrooms and washrooms and smoking areas. Just take smoking areas for a second. If you can put in dividing areas in your smoking areas, you should do that and create that separation. For lunchrooms, similar to the previous slide, is that you need to develop a very rigorous cleaning and disinfecting schedule for your lunchrooms and ensure that's carried out before people use the lunchroom and after they use the lunchroom. And make sure that you have a schedule, and I'd even post it, and I'd show that it's been done on a regular basis, and perhaps appointing a person responsible to carry out that particular activity. You also want to, if you can, if it's feasible, is to establish a one-way traffic flow to the lunchroom and from the lunchroom. Washrooms are a little bit more challenging, and you need to dedicate a specific cleaning and disinfecting regimen for your washrooms, and even the bottleneck points where you have probably one door leading into and out of your washroom. So putting in controls there as well to make sure that you have or create that 2-meter distancing when you're exiting or entering the washrooms. So a lot about cleaning and disinfecting for these particular areas that's paramount.
And if I may interject there about the smoking, because I hadn't noticed that before on the slide, wash your hands before you smoke, because a great way to spread the infection. Don't put your cigarette down on the end of a table between puffs. And maybe this would be a great opportunity to think about giving up smoking because it increases your risk of having serious disease.
And I'll just chime in on smoking. This isn't the purpose. It's one of my pet bugaboos when I operated businesses in Fredericton, and is that the amount of time that you lose, productive time, to smokers each day, a small business that you are paying for. So I would strongly recommend going to smoke-free environments, but we felt we had to put it in there because there are still a lot of smokers in this world. Glenn, over to vehicles and use of vehicles.
Yeah, thank you, David. Yes, I'm currently working with an employer on this particular issue. So what we're looking at, if we can maintain single-use vehicle, that's the preferred method. In a lot of cases, we can't do that. A lot of carpooling, a lot of sharing of vehicles. So if it's 2 persons in a vehicle, driver and the passenger should be in the back on the passenger side, with both people wearing a non-medical mask. You should employ a case disinfecting protocol beforehand and after use. If it's multiple users, of course, then all persons in the vehicle would have to be fitted with the non-medical mask. And of course, again, that cleaning and disinfecting protocol prior to and after use, and again, back to the hand hygiene. Those are critical measures for sure.
Excellent. And next slide, and over to you, Matthew, about because like physical maintaining 6 meters is 2 meters, excuse me, is critical, the 6 feet. But we hear a lot about hand washing and hand sanitization. So maybe if you could tell us the real fact.
Again, apart from people breathing directly on you, the most common way is people self-contaminating. And in fact, even with healthcare professionals who now make up about 16% of cases of COVID, it's because they've touched the surface and then touched their face. And these are people who are trained to never touch their hands to their face. I remember being a clerk in surgery, and when you'd go in the operating room, you have to keep your hands below shoulder levels at all times. And if you ever raise your hand up towards your face to adjust your mask, as people want to do, the charge nurse, who typically had a retractor in her hand, would reach across and give you a good whack across your hands. So you learn very quickly. And during H1N1, when I was at Bell Alliant, when we were having meetings to talk about our planning, I used to charge people 25 cents every time they touched their hand to their face during the meeting. Made a lot of money. But so keeping one's hands away from their face is critical. But you can touch your face. We have to touch our face when we eat, when we do things. The key is washing our hands, washing them well. And soap and water is still the best way. The advantage of soap and water is that it gets under your fingernails. It gets into all the cracks, and soap knocks off any dirt that may be there. And the virus may be underneath a little bit of dirt or grime or loose skin. Whereas a sanitizer, good, but it's not as good as soap and water. I don't think most of us get under our fingernails with Purell. We sort of just rub our hands, do this, and that's it. Washing is a 20 to 30 minute deal. Sort of washing down your fingers, pushing the dirt off your fingers, and getting under your nails. So lots of hand washing.
What about hand sanitizing versus soap and water? Which is better and why?
Soap and water is obviously better. not as available, of course, all the time, but where it is available, it would be the preferred product. And again, because it lifts off dirt under which the virus, it gets into more spaces than the Purell will, and you spend more time doing it. Purell is sort of and you're off. Okay, and it should be a good gob of Purell. Don't be shy about it.
Okay, so to be crystal clear, then the good old-fashioned hand soap and water is superior to hand sanitizer.
Absolutely. And again, whenever you come inside the house from outside, wash your hands. Go to the sink, wash your hands.
And the next slide is simply a web. There's a web link to this in our materials. And Health Canada has some great stuff on. But quite frankly, employees, until COVID came, I was probably like the rest of the world. You do your 5-second hand wash or 10-second, think you're great. And so the education of employees on how to properly hand wash, believe it or not, is, in my view, extremely important. We can go to the next slide. And so it's critically important, though, to have hand washing stations for customers, employees, if feasible. Some of the supermarkets have done a great job. Small business, it likely isn't feasible. So the most important thing is to have lots of hand sanitizer for the customers, for the employees to use regularly. And when people are taking breaks or going to common areas, make it a requirement your employees wash their hands. Next slide. Okay, so you need to both educate those that are coming into your business and, very importantly, your employee, that what we're talking about are important safety rules. They're not nice to do. They're not negotiable anymore. They're what you need to do when you come to work. So these are hard, fast rules on hand, coughing and sneezing, hygiene, physical distancing requirements, PPE requirements, and other ways that we work in the workplace, completing the questionnaires we've talked about, reporting systems. Those are rules. They're no longer negotiable. So I'm going to hand it over now to Brad on the next slide, who's going to talk about effective ways of implementing work rules. Over to you, Brad.
Thank you, David. I was engaging with some folks there a moment ago on the chat line about washrooms. So at the end, if we have some time, people can ask some further questions about washrooms. So in New Brunswick, we have a legal requirement to create our work rules. We have to have our operational plan, and our operational plan should be that guiding document that has all of the safety protocols that we're going to employ. There's a bunch of questions that are going to come up about what happens when employees don't want to come back to work, if they're uneasy, if they're uncomfortable. And as I mentioned on Wednesday, for those of you, there's a lot that you can do as an employer to preempt those concerns. And that's by having a very good operational plan and communicating these protocols to employees. I currently work in a workplace that has about 300 individuals. They're all at home, and we're looking at plans to return them to work. And yes, there's going to be things that are going to be inconvenient, but they're all done in the interests of people's health and safety. So if we're making restrictions about arrival times, about number of people in elevators, number of people in washrooms, about usage of kitchenettes, all of those things are inconvenient. But if they're explained to employees clearly and compliance is required, people understand that, and people will be less reluctant to come to the workplace. And so through that, you want to make sure you have your operational plan, you have your signage. And of course, one of the things in the materials that we gave you, one of the documents, I think it was the third template document, was a document that you would give to your employees where they sign off on the document and they give their commitment that they're going to follow these health and safety obligations. As a person who does a lot of health and safety cases, I find that quite often, you'll end up with a situation where, you say to your employee, we want to get a medical note to clear you to return to work, or we want you to participate with our drug and alcohol testing program. And the employee says, well, why? Why do I have to do that? And the thing that you got to remind your employees is in the New Brunswick Occupational Health and Safety Act, yes, there's a requirement that the employer ensure a safe workplace, but there's also in black and white a requirement that an employee take all reasonable care for their own health and safety and that of their coworkers. So if employees are being asked to maintain social distancing, wash your hands, follow all of Dr. Burnstein's excellent advice, and you get them to sign it, that's a good thing you can do, and we have that in our materials. Next slide. So all of the provinces that are reopening are doing so on the premise that COVID-19 is still going to be in the community. There's still going to be people that are contracting COVID-19. So, just because you're opening up, it doesn't mean it's over and you're not going to experience an issue of COVID-19 in your workplace. So I think that you guys all have to plan for this, what happens in your workplace when someone is COVID-19 positive. And so that's why you have those in New Brunswick, there's the active screening and the passive screening, and there's the screening signage that you should post at your door. And we talked, I'm not going to repeat this, we talked last day about the basically the survey that employees are going to do. And so all of those things, it's your legal obligation to keep individuals that are exhibiting COVID-19 symptoms out of the workplace. And you actually have the authority as the employer. If someone says, yeah, I've got 2 of these symptoms, but I still want to come to work, you have the authority to say, no, the law in New Brunswick is we have to keep you out of our workplace. And so what happens if someone is dishonest on the survey, or lo and behold, they felt fine in the morning, but as the day progressed, they developed symptoms? Well, you're going to have to exercise your obligations as an employer and remove them from the workplace and say, look, you might have told us this morning that you weren't exhibiting symptoms, but we've seen you coughing and sniffing and runny nose. In the interest of protecting our workplace and our employees, we have to take you out of the workplace. Just a comment here quickly. I have dealt with a number of cases in different types of industries of what I'll call COVID positive employees. I've dealt with the situation in a residential care facility, kind of nursing home environment. I've dealt with it in various types of retail and also in manufacturing. And what's going to happen is when someone is COVID positive, the first organization that's going to know even before you is public health, because they're going to be tested in New Brunswick through a hospital who's going to communicate that positive test to public health. And then public health is going to start the process of the contact tracing and reaching out to you as the employer. And so when that happens, you're not on your own. Public health is going to be there to provide you with guidance, and they're going to be actually leading the charge, if you will, on the contact tracing for that positive case. And so you're there to help facilitate that. And for those individuals that would have come in close contact with that person within 14 days, you'll be assisting public health in making sure that they get tested and they self-isolate as required. One thing I will say in Atlantic Canada, and Dr. Burnstein, I know there's different methods in different provinces, but generally speaking, for a COVID positive employee that's going to return to work, we'd like to think that, they're going to be tested again, and I'm going to get some nice document from the province of New Brunswick that says this person has been tested again and they're not contagious any longer. The reality is that's not happening in Nova Scotia and New Brunswick. What's happening is what public health is doing is once the person's symptoms start to subside, they're starting a countdown clock of 10 days. And once that 10 days is gone, public health is fairly confident, or I would say more than fairly confident, they're confident that the person is no longer contagious. And so I dealt with this situation once again in a residential care facility where my client said, like, we just can't, we need some kind of a certificate or a test in order to bring this person back. And it ultimately led to them getting on the phone call with the chief medical officer of health, who said, look, we're the experts, we're the scientists. 10 days after symptoms have started to subside is enough for us to be confident that they're not contagious. And the chief medical officer of health also said, this person's going to come back to work and they're still going to have some symptoms. And it was described to me as a post-viral cough. Doesn't mean that they're still contagious. Now, I've just waded into medical advice there. So I'm going to pause for a moment so Dr. Burnstein can correct anything that I've said inappropriately.
You're absolutely right. Getting testing for determining people have recovered is very difficult. There are 2 approaches. You can use a symptom-based approach where 14 days from the start of infection, and you're assumed to be free of disease, assuming you don't have a fever without medication or any other symptom other than the cough. The cough, unfortunately, can persist for several weeks after full recovery. So you can either go with a symptom-based clearance to return to work, or stopping of isolation, or you can go with a testing approach. And for healthcare professionals and other first responders, the preferred approach is doing a swab, but given and 2 negative swabs taken 24 hours apart, still after 14 days from the start of illness or exposure, will clear somebody to return to work. But given the lack of testing, the 14 days of the symptom-based approach is being used, and getting certificates from doctors or from public health is incredibly difficult, and not really a practical approach. In some provinces, like Nova Scotia, they are using the 10 days. British Columbia is also using 10 days. The Centers for Disease Control also has a guidance in which 7 days from last symptom, you're allowed to return to work as well. There are all sorts of guidelines out there. So the 10 to 14 days seems to be the standard.
And maybe, Brad, if you could comment, we've put in the document package for participants a written declaration of completion of self-isolation. Maybe you might comment on that before we move on to worker rights.
Yes, thank you, David, and thank you, Dr. Bernstein. You'd almost think we planned this. Next slide, please. The next slide is exactly what David and Matthew were just talking about, both of their points. So Matthew made the comment that it's very difficult to get medical notes right now, and he's absolutely right. I know with a lot of clients that I've been dealing with, and they've been wanting to get medical notes from doctors, it's very difficult. We'll talk in a moment about New Brunswick and an amendment to its Employment Standards Act. But in the Employment Standards Act, it actually says that if someone is taking a COVID leave as an employer, you don't have a right to ask for a medical note. So that's the comment on medical notes. And so in response to that, what David alluded to is another document, which is in our little compendium of precedents that we gave you, and we call it the Employee Declaration. And so there's a whole bunch of different reasons why someone may have to self-isolate. And I'm not gonna list them all, but it could well be that they themselves develop symptoms. That could be one. It could well be that they traveled outside of the province. That's another. Could well be that they have someone that they've been in close contact with who's developed COVID-19. So there's a whole bunch of reasons why someone might have to self-isolate. And so as an employer, when someone starts to self-isolate, what we suggest you do is you track it somehow using a spreadsheet that Johnny or Sally, the last day in the office was X, and we're going to do the 14-day self-isolation. But before they come back, what we've provided is an employee declaration that, once again, they have an obligation for their health and safety. They sign off on that says, I, Johnny or Sally, hereby declare that I self-isolated and I followed the advice of a medical doctor and or public health. And so I was, self-isolated for the requisite period of time. Here this is, employer, I now want to come back to work. And so that precedent or document is in your documents. Next slide, please.
I'll take this one here, Brad, and we'll be back to you in a second, so that you always have to be cognizant of your workers' rights. And we're going to have Brad speak to these here in a minute. The right to know, we've talked about that. They need to know what the risk is when they come to work and what we're doing to manage the risk. They have to have the right to speak up, which they have through the occupational health and safety committees, or they have that right. And they have the right to refuse work if they believe that it's unsafe. But Brad's going to comment on the parameters where that can be done in the context of COVID. And so next slide, the most common issues that you're likely going to, especially the businesses that are just opening up as we go to yellow in New Brunswick, and as Nova Scotia continues to open up, is the refusal of a worker to return to work. Do you have an obligation to accommodate? Managing employees who are at work who just refuse to work. There have been some, as Brad said, some amendments to the Employment Standards Act. And there are exceptions, work exceptions, where you can have people travel inside the province. So Brad, maybe if you could, the most common one that you're seeing in your practice, the refusal to return to work. If we go to the next slide, and Brad, if you could take the next few slides.
Sure, thank you, David. So we've heard a number of reasons why employees have said to their employer that they don't want to come back to work, or they're not comfortable coming back to work. And employers, have a variety of reactions. In some cases, that's okay, because employers are saying, well, as I scale back, I'm going to be at 50% capacity for a while, and so it's okay if so-and-so wants to stay off. In some other workplaces, the employer said, no, that's not okay. I need that person, and if they don't come back, I have to hire someone to fill their spot. So that's kind of the situation that employers are encountering with, and I'm not sure what your specific situation might be, but these are some of the common reasons that are popping up, and the legalities associated with those reasons. So the first that you're hearing is someone say that they have an illness. So they may say that they've been treated for a severe illness and they're on medication. I'll once again use a medical phrase that I'm probably not licensed to use, but they're immunocompromised. Those are all issues that, if legitimate, protects them under human rights legislation. So they have a legitimate disability, and coming back to the workplace and potentially being exposed to COVID-19 could be catastrophic. Another one that I kind of put in that category, which I have seen, is mental health issues. So individuals that may suffer from an anxiety, depression, or mix of anxiety and depression may have a legitimate basis. And those are things that, as employers, if you simply ignore and terminate the person, you could expose yourself to a human rights issue. So that's something that you have to accommodate. The next category is what we're calling family illness. And we're seeing people say, well, I have a spouse or an elderly parent that is immunocompromised. And so that's something that that has some legitimacy to it as well, because as we know in our provinces, we also give human rights protections to family status, and that's the relationship of individuals, and depending on your province, being in a family relationship. So there could be a human rights protection there. And in the New Brunswick Employment Standards Act, which we'll get to in a little more detail here on the next slide, I'll finish this one first, that is also a protected ground. The next one that we're hearing is the child care obligation. Either, well, I've been off work, but while I was off work, my daycare closed down, or the school closed down. And so those are also legitimate obligations, and those are also protected in the Employment Standards Act. And the one that we're also hearing commonly is the personal preference. And so that's where the person is saying, I'm just not comfortable at returning at this time. I'm going to wait and see. Another common one is, I am getting the Canadian Emergency Response Benefit, or the CERB benefit. That's $2,000 a month. When I work for you, I only get about $2,500 a month. So I'm fine not doing any work for $2,000 as opposed to working a full work week for $2,500. Those reasons, those last category, are not legitimate. And so you as the employer are within your rights to manage that, to warn, to discipline, and ultimately dismiss. And so the advice I've given clients is when clients call me up and they say, yeah, I called on the telephone to get my employee to come back, and they gave me this litany of excuses, and now I want to fire them. What I'm advising is I'm saying, geez, you really didn't protect yourself very well by doing it on the telephone. You should have done it in writing, either through email or a letter. And so make sure that you're documenting these situations. So if you do warn, discipline, or dismiss, you've at least protected yourself, that you have a paper trail of what the reason given was. Next slide, please. So kind of midway through April, I think it was April 16, the New Brunswick legislature amended the Employment Standards Act. And what they allowed for was an emergency leave for COVID-19. And so basically what this means is, if any of your employees are off because of any of these reasons, then you are precluded from warning them, dismissing them, because they're on a protected leave. And the categories in the legislation, I've kind of bulleted here on the slide, but one of them is that they're under investigation, supervision, or treatment. So that's a person who has COVID-19 or is being tested for COVID-19 or is self-isolating. They're required by public health officer to self-isolate because of contact tracing. They are in quarantine or self-isolation, or they are providing for care to a family member that's COVID-19 related. And that's probably the one that's most gray, but is broad. And that could be the person who has the family member who's ill. That could be the person who has the child who there's no daycare. There's a fact sheet online, and you can Google it. It's issued by the New Brunswick government, and it's about 4 pages long, and it gives you all kinds of different examples with respect to these issues. And so you can Google it, you can print it off, and it gives you some specific advice on how does this mean with respect to the ill family member? How does this apply with respect to childcare? Because you do have the right to ascertain, well, are there other people that could care for your child, or is this exclusively on you? In the legislation, once again, you're not allowed to ask for a medical certificate. So back to what Dr. Burnstein said, it's hard to get them at the best of times, but you're not allowed to say, well, prove it to me, I want a medical certificate. And the reason I think the government did that was so that we're not flooding doctors and physicians who are supposed to be caring and treating people at this time with requests from doctor's notes. And this leave, of course, if it wasn't clear, you're not required to pay individuals on this leave. It's an unpaid leave. Next slide, please. So David alluded to the right to refuse unsafe work, and that is another legitimate reason why someone may say they don't want to come back. And that is when David talked about the kind of the right to know, the right to participate, and the third right was the right to refuse. That's what this is referring to. And it's under health and safety legislation. And it's basically the same in all Canadian provinces, subject to a few nuances, but an employee has to have reasonable grounds. And so an employee just can't have a fear. They can't just say, look, this COVID stuff is scaring me. I hear a lot about it on the news. I don't want to come back. That's a fear. That's not reasonable grounds. And there's all kinds of cases on this that developed out of H1N1 and SARS that prove that it's got to actually be a reasonable ground. And I mentioned this statistic on our last call, but in Ontario, there had been 250 formal official work refusals filed, and the government had not kind of declared that any of them were legitimate. And so the bare fear of returning to work is not enough. Next slide, please. As far as the process goes, we've kind of bulleted here on the slide, but an employee has to report to the supervisor or you as the owner manager and say, here is my legitimate concern. You're having me come back to the bar or to the restaurant or to the salon, and you're not giving me a surgical mask, you're not giving me a shield, and I think that affects my safety. So what then happens is you as the supervisor at the first step, you get to investigate that, and if you can resolve it to the employee's satisfaction, they go back to work. If it's not resolved to the employee's satisfaction, they can escalate it to the Joint Occupational Health and Safety Committee in your workplace, if you have one. And if they're not satisfied with the Joint Occupational Health and Safety Committee's recommendation, then it can be escalated to WorkSafe New Brunswick. And WorkSafe New Brunswick, as kind of an impartial arbiter, can come in and ultimately make the decision as to whether or not it's safe or not. A couple of other points on this is you can assign the employee to other duties while you're investigating the work refusal. And you can assign another employee to those duties that the person has refused, but you've got to be very transparent and clear as to the fact that there is in fact a work refusal. Next slide, please. So the last slide that I'm going to speak to is the issue of the travel in New Brunswick. And I am myself a New Brunswicker and love New Brunswick music. And this makes me think of the David Miles song that he wrote for CBC a number of years ago as part of the Songwriters Challenge, Drive Right Through, for those of you that know that song. New Brunswick is a little bit different than PEI, a little bit different than Newfoundland, a little bit different than Nova Scotia in that, you know, within a short distance, you've got the Nova Scotia border, the PEI border, the Maine border, and of course, the Quebec border. And so I have lots of clients that, have employees that work in Amherst, that live in Sackville and Moncton, or they work in Edmundston, but they live in Quebec. And so there's all kinds of travel issues. But the main thing to know is that there are several categories of essential employees that are allowed to enter the province and do not have to self-isolate. And the categories that they fall within are if they maintain critical infrastructure, such as telecommunications, data, fuel, electricity, manufacturing, and financial systems. That's one category. Another category is that they are involved in the transportation of kind of what I'll call the food supply network. Or there's individuals that are traveling through and they commit that I'm just traveling through, I'm on my way to Nova Scotia, and I'm only going to stop as necessary for food. And if you actually do live in one of those border towns, as I mentioned, then you can be approved to go through as well. So there's those categories. Then there's kind of another process in place for individuals that don't fit those categories, and that's actually filling out a WorkSafe New Brunswick form and sending that form through to WorkSafe New Brunswick 15 days in advance and saying, here is the person that I need to come into New Brunswick, and this is why I need them to come into New Brunswick, and there's no one in New Brunswick that can do this same thing, and you need to get advance approval from WorkSafe New Brunswick for that. And if you do, then there's going to be requirements on you and that employee does not intermingle with your other New Brunswick employees, that when they go back to their hotel or accommodations at night, they're staying put and they're not intermingling with other New Brunswickers. It's effectively, you're bringing that person into the province, but you're required that when they're in the province to effectively isolate them from the rest of your workforce and the rest of New Brunswickers.
Thank you, Brad. And last thing I'd ask you to comment on, and I can see I didn't properly populate this slide for you because I thought it was important in Campbellton to be able to go over and get beer in Quebec, but did I say that? The temporary foreign workers, there's been a lot of discussion on that in New Brunswick. They're very important to fish plants and for agriculture. Have those rules been relaxed now?
David, that's an area that I'll confess to not, we have an immigration lawyer at our firm, and she's been handling most of those issues. I've not been personally, dealing with the kind of temporary foreign worker issue, so I don't want to misspeak or say something that I'm not schooled up on.
Okay, your grades were going very well in this legal exam to that question, so we'll, Brad, appreciate those comments. And going to the last slide, I want to thank everybody for participating, and we're going to open up to questions. I know we went a little longer than anticipated, but this was all very important stuff. And I'll just make my my final plug. All of the speakers have contributed to the food bank in a meaningful way. And if you're able to do that, we'd ask you to consider it, because there are a lot of people that are going to food banks that in their wildest dreams never thought that they would be, because of the what COVID has done to the business world, and especially small business. And as I said last time, you folks are the backbone of the Canadian economy. You've been hit the hardest. And the great thing about small business is entrepreneurs always find a way to make it work. So thank you for having us.
Thank you very much to all of you. That was another great presentation. We've got about 10 minutes left here, so we'll try to get through as many questions as we can. I'll try to focus on questions that particularly pertain to the subject matter at hand. There's a few that are tangential. The first question here is about government programs for employees that don't qualify for EI, CERB, or the wage subsidy. I'll just say on that we shared this week a good tool from Deloitte that summarizes federal and provincial programs. So that would be a good place to start with that. I don't know if any of the presenters want to add to that. We weren't talking about that per se today.
Brad, we've both done a lot of work. Why don't you grab that one?
Yeah, thanks. I mean, it is what it is. There's been a lot of discussion on it. Morgan, you've mentioned you've got some materials. I mean, right now, we know that the CERB, Canadian Emergency Response Benefit, that is where the government has driven everyone who has been effectively laid off, self-isolated. They've driven them through the CERB. The CERB, as we know, is more than half over. It's a 4-month program. But keep in mind, it's 4 months. But if you have employees that have not yet applied for it, it can go as long as until September. So that's that. With the Canadian Emergency Wage Subsidy, that was initially started for a 3-month period, and we know that that has been extended. So that has been in place. And with the Canadian Emergency Response Benefit, all of the literature has said once your CERB has kind of expired, if you still are off and you're eligible, you can still apply for employment insurance. We don't know what the government may or may not do with CERB, whether or not they may extend it or not. We don't know. And the unfortunate reality is there's going to be situations where people are going to struggle if there's no benefit available for them. That's been the case. I mean, all along, as you followed this thing week by week, I mean, initially students didn't qualify. Initially, seasonal employees didn't qualify. And the government, I've been on phone calls with federal ministers, provincial MLAs, and they've all used the phrase, the 2 quotes that I've heard from a couple of different sources were policy making in real time. And Minister Joly, one person mentioned her name in the chat here, she used the quote in one of the calls I was on with her, "We're building the airplane as we fly it." And so, if as far as knowing what's coming next, the best you can do is kind of read and consult, but we don't exactly know how long or what further things could be extended.
Thanks. Next comment I'll direct towards Dr. Burnstein. I saw something in the news yesterday that COVID doesn't stay on surfaces. So maybe some evolving understanding of the different surfaces and all that.
Well, it certainly lives on surfaces and can be cultured on surfaces. I'm not sure what the report said. The question is it a meaningful means of contracting the infection? 12 hours later, you may be able to swab the virus and grow it on a petri dish. But is that sufficient? If you touched that swab and stuck it up your nose, would you contract the infection? I think what I've been reading is that surfaces are a limited source, a minor source of infection, and that it's really mostly spread by coughing on people.
Okay, thanks.
Breathing on people. But we're going to know more in 6 months' time. Meanwhile, play it safe, lots of hand washing.
Try not to speak nicely. Brad, you alluded to this earlier, a couple of questions about washrooms. What is the recommendation for cleaning washrooms and communicating the number of people using the washroom facilities at any one time? Got a couple of comments in there too. You just want to talk a little bit about that for the group?
Well, I did post some chat comments here in response to those, but I'll just quickly summarize them. Yeah, you're going to have to limit the number of individuals in your washrooms. I know the washroom, I'm on in the Purdy's office complex in Halifax, and we have washrooms on every floor. But they have 2 stalls and 2 urinals, obviously in the men's. I don't know what the women's has, but there's not 2 meters anywhere in that washroom, right? So we're going to have to go down to 1 person per washroom, and we have sourced some signage that you can move with your elbow, and basically you move it with your elbow, so you don't have to touch it, and it says occupied. And so it's on the door, and it's stuck to the outside of the door, and when you go in it, you slide it over with your elbow, and it says occupied, and you go in. And so the rule that we're going to have is when you come up to that door and it's slid over and says occupied, you don't go in. So those are kind of some of the strategies. As far as cleaning, I think I'd defer to Glen for the best practices in that regard. Glen, if you have any comments on that.
Yeah, thanks, Brad. And that's an interesting point that you mentioned about your son, because we also looked at a procedure in our particular workplace. We have, we have 200 plus people, and we share a common washroom for men and common for women. So it's very difficult even to get to 1 person in the washroom. So looking at strategies to maybe have 2 or 3 and staggering out the basins, staggering out the toilets and the urinals and things like that, putting in procedures. So lots of things we can look at from an administrative perspective. From a cleaning perspective, again, I go back to the cleaning detail. Develop a washroom cleaning schedule. Make sure that cleaning schedule is being carried out at the workplace on a daily basis, and you're using the products that will eradicate the COVID virus, as mentioned through Dr. Burnstein there, the Health Canada reference. But develop the schedule, make sure it's being cleaned, and also have signs up about wash your hands, wash your hands, wash your hands. Critical.
Hey, thank you. Next, a question for Dr. Bernstein and Dr. Bernstein only. We mentioned to staff that we may need to take thermal temperature after the last webinar. One of the staff mentioned that some of us are going through menopause and may have hot flashes, which might affect the internal temperature.
Oh, absolutely. A hot flash can put up your temperature almost by a whole degree. So what to do? I mean, it's a challenge. The other interesting thing though about menopause, when you're not going through the hot flash, your temperature is actually a quarter of a degree lower. And women's temperatures normally are almost a quarter degree higher than men to begin with. So 37 is the average of men and women. So what to do if someone is having a hot flash? I think as discreetly as possible, say to the person, can you give me, and most hot flashes are a matter of several minutes, although in some people they're longer than that. You might have to say, look, I'm not feeling well at this very right moment. It's not a good time to take my temperature. Can I just stand off to one side for 5 minutes, 10 minutes, and then take it again? Which hopefully will be sufficient. But it would be unusual for somebody's temperature to go from 37 to 38 with a hot flash, maybe 37.5, 37.75, but higher than that would be unusual.
Okay, thanks. Are those hand washing stations that some supermarkets have used that use cold water and operated with a foot pump, are they effective?
Cold water works well. Hot water is better, but even cold water and soap is still slightly better than Purell.
Thank you. Staff of 2 employees, do we need a written operational plan in place? I believe the answer is yes.
Absolutely.
Yep. Just trying to get through a couple more here. There's a couple of questions about allergy season and dealing with the fact that some of those symptoms are going to be the same as COVID symptoms. How do you suggest companies deal with that?
One of the key part of the questions is it a new symptom or new or unexplained symptoms? So someone who's got chronic bronchitis and they're coughing all the time. So you ask them a question, do you have a cough? It's really, do you have a new cough? And with allergies, is it the runny nose and that you have every March, April, May, or June, depending on what province and where spring arrives. So it's a new symptom for you. So you have to, as we always must do in these situations, trust that our employees or the people coming in are being honest.
Okay, we're at 11 o'clock. We'll do one more, combining a couple of childcare, daycare questions. At what age is the childcare obligation over? And are there special circumstances after that age where a person can refuse to work? And also, as a supplement, I ask, because we have this specific question from a member, are they able to ask the daycare operator for a letter confirming that they're either closed or that employee does not have childcare right now? We know you can't ask for that from a doctor, but is it the same for a daycare operator?
Brad, this is yours.
Sure. So I guess what I'll say to you is the world is really changed and really strange. And, on the one hand, as employers, we're getting these additional rights. You can imagine this time last year asking your employees about their symptoms. And if they had a sniffle or a cough, saying, stay home, you can't come to work. So we've been given as employers these kind of additional obligations and powers. But in the same token, all of this is expected to work kind of in a trust situation, in a trusting situation. And that's why I can only imagine the New Brunswick government said, we're not going to let employers go and ask for doctor's notes on all these situations. That's going to flood the system. So I guess I would say from the first standpoint is, we should be having positive, trusting relationships with our employees. And so if someone says they don't have daycare, yeah, that's good. If we're dealing with someone who's been a kind of a chronic abuser, chronic absenteeism, maybe we do have trust issues, yeah, I think you can go a little further. And once again, as a lawyer, I can't stress enough the importance of documentation and saying, dear employee, we just want you to confirm for us in a return email that exactly we've called your daycare and they appear to be open for business. So exactly why do you not have daycare? And please confirm that back in an email. And when they do that, then you may have to, if you think they're lying to you, you would have a right as an employer to investigate and impose disciplinary action if you believe that they are in fact lying to you. So I think you're going to have to look at those on a case-by-case basis. I would say that we don't want to kind of start with the proposition that we think all our employees are lying, but where we think that there may be someone who's trying to take advantage, then we can kind of follow that through, is what I would recommend.
Okay, thanks.
Morgan, was there another question?
No, that was kind of the two together. One about generally dealing with what's the age for daycare, or is there a specific age that that's an obligation?
Yeah, I know I have 3 kids at home. I have a 14-year-old and a 12-year-old and 8-year-old. And right now, I wouldn't be comfortable kind of leaving them on their own, and so I think that's a tough question. And I think it's a case-by-case question. The other question is, are there special needs? It could be a 25-year-old dependent. So I think you're going to have to look at those situations on a case-by-case basis.
Okay, thanks. Well, it's 11:03. I think we'll wrap it up there. Thank you very much to our presenters, Matthew, David, Glenn, and Brad. Thank you to Atlantic Chamber for co-hosting the series with us. Sherry, thanks for joining us this morning. And everyone, please support your local food bank. It's a real small ask for the value I think we've all gotten out of the 3 hours here this week. We really appreciate it. These are 2 great sessions. I can't say enough about them.
And Morgan, I'm just going to say this, that I just like to thank my co-presenters. I know Glenn has got a busy job, trying to keep people safe in a very dangerous construction environment. Matthew's got a very busy medical practice. Obviously, they've dumped huge amounts of time. But I think on behalf of all of us, I think we'd say the person who really kind of pulled this together and took all the beautiful slides that you saw and all of the organization was David and David's team. So thank you, David, for being kind of the leader of this group.
Thanks, Brad.
Okay, thank you. And yeah, I agree. It was great working with you, David, and hopefully we can do something in the future. So let's all go see Premier Higgs announce phase 1 of Yellow. And